He woke up feeling dizzy, a little lightheaded. He thought it was just low blood pressure, something that happened to him occasionally when he stood up too fast. He sat down for a moment, waiting for it to pass. His wife asked if he was okay. He said yes, just feeling a little off. Maybe he needed to eat something. Maybe he was dehydrated. 30 minutes later, he collapsed. By the time the ambulance arrived, half of his face was drooping, his speech was slurred, and his right arm was completely paralyzed. He was having a massive stroke. And those critical first minutes, when treatment could have saved him, were lost because he mistook the warning signs for something harmless. This happens more often than you think. The symptoms of dangerously low blood pressure and the early signs of a stroke can overlap in frightening ways. Dizziness, weakness, confusion, difficulty focusing. Both conditions can make you feel like you just need to sit down and rest. But one of them is stealing blood flow from your brain right now, and every second you wait increases permanent damage. Today, I'm going to show you exactly how to tell the difference between low blood pressure and a stroke in under 60 seconds. I'm going to teach you the fast test that emergency doctors use. And I'm going to give you a critical warning about a specific type of low blood pressure that doubles your stroke risk. Stay with me until the very end because I'm going to reveal the hidden connection between orthostatic hypotension and stroke, a link that most people, even some doctors, don't fully understand. This information could save your life or the life of someone you love. Let's begin. Before we talk about how to identify a stroke, you need to understand why low blood pressure and stroke symptoms can feel so similar. Both conditions involve reduced blood flow to the brain. When your blood pressure drops suddenly, your brain isn't getting enough oxygen-rich blood. You feel dizzy. You feel weak. Your vision might blur. Your thoughts might feel foggy. These are the brain's warning signals that it's not getting what it needs. A stroke, specifically an ischemic stroke, which accounts for 87% of all strokes, happens when a blood clot blocks an artery in your brain. That part of your brain is suddenly cut off from its blood supply. The cells in that region start dying within minutes. And the symptoms you experience, dizziness, weakness, confusion, can feel almost identical to low blood pressure in the first few moments. Here's the critical difference. Low blood pressure affects your entire brain. The dizziness is generalized. The weakness is generalized. You feel off all over. A stroke affects a specific part of your brain. The weakness is usually on one side of your body. The confusion is often about speech or vision. The symptoms are localized and asymmetric. That's the key word. Asymmetric. One side versus the other. Now let me teach you the FAST test. This is the test that paramedics and emergency room doctors use to identify stroke in seconds. FAST stands for face, arms, speech, time. If you or someone near you is experiencing sudden dizziness, weakness, or confusion, do this test immediately. F is for face. Ask the person to smile. Look at their face carefully. Does one side of their face droop? Is one side not moving as well as the other? If yes, this is a stroke symptom, not low blood pressure. Low blood pressure doesn't cause facial asymmetry. A stroke does because it's affecting the motor control on one side of the brain. A is for arms. Ask the person to raise both arms straight out in front of them and hold them there. Watch what happens. Does one arm drift downward? Does one arm feel weaker or unable to stay up? If yes, this is a stroke. Low blood pressure might make both arms feel weak, but a stroke causes one-sided weakness. That's the difference. S is for speech. Ask the person to repeat a simple sentence. Something like, "The sky is blue today." Listen carefully. Is their speech slurred? Are they having trouble forming words? Can they understand what you're saying but unable to respond correctly? Stroke affects the language centers of the brain. Low blood pressure might make you feel confused, but it doesn't typically cause slurred speech or inability to form sentences. T is for time. If the person shows any of these signs, even if they seem mild, even if the person insists they're fine, call emergency services immediately. Time is brain. Every single minute that passes without treatment, brain cells are dying. The window for the most effective stroke treatment is within 3 to 4.5 hours from the first symptom. After that, the damage becomes permanent. Here's what most people don't realize. Stroke symptoms can start small. They can feel like something minor. A little tingling in the hand. A brief moment of slurred speech that corrects itself. A wave of dizziness. People think it's passing. They think it's nothing. They wait. And that waiting costs them their recovery, sometimes their life. Let me tell you the other warning signs of stroke that don't fit into the FAST acronym but are just as critical. Sudden severe headache with no known cause. This is often described as the worst headache of your life. It can indicate a hemorrhagic stroke, where a blood vessel in the brain ruptures. Sudden trouble seeing in one or both eyes. This might feel like a curtain coming down over your vision or sudden blurriness that doesn't improve. Sudden trouble walking, loss of balance, or lack of coordination. You might feel like the room is spinning or like your legs won't obey your commands. Sudden numbness, especially on one side of the body. This might affect your face, your arm, your leg, or an entire side. Now let's talk about the dangerous connection between low blood pressure and stroke that most people don't know about. There's a specific type of low blood pressure called orthostatic hypotension. This is when your blood pressure drops suddenly when you stand up from a sitting or lying position. You've probably experienced it. You stand up too fast and feel lightheaded or dizzy for a few seconds. For most people, this is harmless and passes quickly. But if you have orthostatic hypotension regularly, your risk of stroke doubles. A large study that followed over 11,000 adults for 25 years found that people with orthostatic hypotension were twice as likely to have an ischemic stroke compared to people without the condition. Approximately 15% of people with orthostatic hypotension experienced a stroke, compared to less than 7% of those without it. Why does this happen? Because when your blood pressure drops suddenly and repeatedly, your brain experiences brief episodes of reduced blood flow. Over time, this can damage the small blood vessels in your brain, making them more vulnerable to clots. It can also cause something called a low-flow TIA, a transient ischemic attack or mini-stroke, where blood flow to the brain temporarily decreases. Here's how to know if you have orthostatic hypotension. Stand up slowly from a sitting position. Pay attention to how you feel in the first 30 seconds. Do you feel dizzy or lightheaded? Does your vision darken or blur? Do you feel unsteady or like you might faint? If you experience these symptoms regularly when standing, you may have orthostatic hypotension. You can also measure it at home with a blood pressure monitor. Take your blood pressure while sitting, then stand up and take it again after 1 minute and after 3 minutes. If your systolic pressure drops by 20 points or more, or your diastolic drops by 10 points or more, that's orthostatic hypotension. If you have this condition, it's critical that you manage it because it's not just about feeling dizzy. It's about protecting your brain from stroke. How do you manage it? First, stay hydrated. Dehydration is one of the leading causes of orthostatic hypotension. Drink water consistently throughout the day, especially in the morning. Second, increase your salt intake slightly, but only if your doctor approves. Salt helps your body retain fluid, which increases blood volume and prevents drops in pressure. Third, wear compression stockings. These help prevent blood from pooling in your legs when you stand, which reduces the drop in pressure. Fourth, stand up slowly. Give your body time to adjust. Sit on the edge of the bed for a moment before standing. Fifth, avoid alcohol, especially in the evening. Alcohol dilates blood vessels and worsens orthostatic hypotension. Sixth, review your medications with your doctor. Some blood pressure medications, diuretics, and antidepressants can cause or worsen orthostatic hypotension. Now let's talk about the other risk factors for stroke that you need to be aware of. High blood pressure is the #1 risk factor. If your blood pressure is consistently above 140/90, you are at significantly increased risk. High blood pressure damages blood vessels over time, making them prone to clots and ruptures. Diabetes. High blood sugar damages blood vessels and increases clot formation. If you have diabetes, managing your blood sugar is critical for stroke prevention. Atrial fibrillation, an irregular heartbeat. This condition causes blood to pool in the heart, where it can form clots that travel to the brain. If you have AFib, you may need blood thinners. High cholesterol. Cholesterol builds up in your arteries as plaque, narrowing them and making clots more likely. Smoking. Smoking doubles your stroke risk by damaging blood vessels and promoting clot formation. Obesity. Excess weight increases blood pressure, cholesterol, and diabetes risk, all of which contribute to stroke. Physical inactivity. Sedentary lifestyle increases all stroke risk factors. Age. Stroke risk doubles every decade after age 55. Family history. If a parent or sibling had a stroke, your risk is higher. Previous stroke or TIA. If you've had a mini stroke, Your risk of a full stroke within the next year is 10 to 15%. Here's what you need to do right now to reduce your stroke risk. First, know your numbers. Get your blood pressure, cholesterol, and blood sugar checked regularly. If any of them are high, work with your doctor to bring them down. Second, take your medications as prescribed. If you've been prescribed blood pressure medication, cholesterol medication, or blood thinners, take them every single day. Skipping doses dramatically increases your risk. Third, eat a brain-healthy diet. Focus on vegetables, fruits, whole grains, lean proteins, and healthy fats like olive oil and fish. Limit salt, sugar, and processed foods. Fourth, move your body every day. Even 30 minutes of walking significantly reduces stroke risk. Fifth, stop smoking. If you smoke, quitting is the single most important thing you can do to prevent stroke. Sixth, limit alcohol. More than 2 drinks per day increases stroke risk. Seventh, manage stress. Chronic stress raises blood pressure and inflammation. Practice relaxation techniques like deep breathing or meditation. Now let's talk about what to do if you or someone near you is showing signs of stroke. Do not wait. Do not see if it gets better. Do not drive yourself or the person to the hospital. Call emergency services immediately. Tell the dispatcher you suspect a stroke. Paramedics can begin treatment in the ambulance and alert the hospital so the stroke team is ready when you arrive. Note the time the symptoms started. This is critical information for doctors because certain treatments are only effective within specific time windows. Stay with the person. Keep them calm. If they're conscious, have them lie down with their heads slightly elevated. Do not give them food, water, or medication unless instructed by emergency services. If they become unconscious, place them in the recovery position on their side to keep their airway clear. Here's something most people don't know. There's a treatment for ischemic stroke called TPA, tissue plasminogen activator. It's a clot-busting drug that can dissolve the clot, blocking blood flow to the brain. But it only works if given within 3 to 4.5 hours of the first symptom. If you arrive at the hospital within that window and you're a candidate for TPA, your chances of full recovery increase dramatically. But if you wait, if you think it's just low blood pressure or something minor, that window closes. The damage becomes permanent. Let me address a common concern. What if you do the fast test and the person seems fine? What if the symptoms go away on their own? This is extremely important. If someone shows stroke symptoms that resolve on their own within minutes or hours, they may have had a TIA, a transient ischemic attack or mini stroke. A TIA is a warning sign. It means a stroke is coming. Studies show that after a TIA, the risk of a full stroke within the next 3 months is 10 to 15%, and the risk is highest in the first few days. Even if the symptoms disappear, you must seek immediate medical attention. The hospital will run tests to determine why the TIA happened and start treatment to prevent a full stroke. Now let's talk about the difference in how low blood pressure and stroke feel from the inside, from the person experiencing it. With low blood pressure, you feel generally unwell. You feel lightheaded, like you might faint. You feel weak all over. Your vision might dim or blur. But you're aware of what's happening. You can communicate. You understand what people are saying. Your thoughts are slower, but they're there. And usually, if you sit or lie down, the symptoms improve within a few minutes. With a stroke, something feels fundamentally wrong. If the stroke affects the left side of your brain, you might suddenly lose the ability to speak or understand language. You know what you want to say, but the words won't come out. Or people are talking to you, but it sounds like gibberish. If the stroke affects the right side of your brain, you might not even realize something is wrong with your left side. This is called neglect. You ignore your left arm or leg as if it doesn't exist. If the stroke affects your vision center, half of your visual field might disappear. You don't see the left or right side of your environment. If the stroke affects your balance and coordination center, you can't walk. Your legs won't cooperate. The room spins violently. Here's the terrifying part. Some strokes don't cause pain. Unlike a heart attack, which often causes crushing chest pain, a stroke can be silent in terms of pain. You might not feel anything is seriously wrong. You might just feel confused or weak. This is why the fast test is so critical. You can't rely on how you feel. You have to rely on objective tests. Can you smile symmetrically? Can you lift both arms? Can you speak clearly? Let me give you a real-world scenario. Imagine you're at home and your spouse suddenly says they feel dizzy. They sit down. They say they're fine, just stood up too fast. What do? You do the fast test immediately. Ask them to smile. Watch their face. Ask them to lift both arms. Watch for drift. Ask them to repeat a sentence. Listen for slurring. If everything is normal and they feel better within a few minutes, it was likely low blood pressure. But if any part of the fast test is abnormal, even slightly, you call emergency services. You don't wait to see if it improves. You don't let them convince you they're fine. You act. Here's another scenario. You wake up in the middle of the night to use the bathroom. You feel dizzy when you stand. You sit back down on the edge of the bed. You think it's orthostatic hypotension. But then you notice your right hand feels numb, or your speech feels slightly off. That combination of symptoms, dizziness plus one-sided numbness or speech changes, is a red flag. You wake your partner. You call emergency services. Now let's talk about recovery and what happens if stroke treatment is delayed. The brain is incredibly time-sensitive. Brain cells can only survive a few minutes without oxygen before they die. When someone has a stroke, there's a core area where cells die immediately. But there's also a surrounding area called the penumbra, where cells are damaged but not dead. This is the area that can be saved with fast treatment. Every minute that passes, more of the penumbra dies. After 6 hours, most of the penumbra is gone. The damage is done. If stroke treatment is delayed, the consequences can be devastating. Paralysis on one side of the body that never fully recovers. Permanent speech loss or difficulty. Loss of vision. Cognitive impairment. Loss of independence. Many stroke survivors require long-term care. Some never walk again. Some never speak clearly again. And all of this could be prevented or minimized with immediate treatment. My friends, I need you to understand something very clearly. The difference between full recovery and permanent disability after a stroke often comes down to one thing: time. Not the severity of the stroke, not your age, not your overall health. Time. If you recognize the symptoms and act immediately, you give yourself or your loved one the best possible chance. Memorize the fast test. Teach it to your family. Practice it so it becomes automatic. Face, arms, speech, time. If any of these are abnormal, call emergency services. Do not wait. Do not second guess. Do not let embarrassment or inconvenience stop you. A stroke is a medical emergency, just like a heart attack. Every second counts. If you have risk factors for stroke, high blood pressure, diabetes, atrial fibrillation, high cholesterol, or if you have orthostatic hypotension, talk to your doctor. Get screened. Start treatment. Make lifestyle changes. Your brain is worth protecting. Thank you for watching. Share this video with everyone you know. This information saves lives. Stay safe.